Welcome back, Deep Divers. Today we're going to jump headfirst into the world of nursing ethics and scope of practice.
Oh, exciting.
It is. We're using excerpts from a couple of PowerPoints,
Yeah.
one focusing on nursing ethics, and the other's all about, the scope of nursing practice.
So, like, what nurses can and cannot do.
Exactly. By the end of this deep dive, you'll not only know the rules, but you'll get a feel for those tough calls nurses face every day and how they use ethics to, find their way.
So, like, they have this inner compass, but instead of pointing north, it's guiding them through these really tricky situations.
Love that. Okay, so first things first, why are we even talking about ethics in nursing? I mean, all healthcare folks got to be ethical, right?
Oh, absolutely. But think about it. Nurses are often right there on the front lines with patients, like all the time.
Yeah, they're the ones spending the most time with them.
Exactly. Advocating for them, and sometimes even having to make judgment calls in pretty intense situations.
So it's like walking a tightrope between patient care and sometimes some really tough choices.
You got it.
Hmm.
The PowerPoint actually points out a few scenarios nurses might find themselves in, like reporting a sudden change in a patient's condition,
Hmm.
you know, or recommending care that might clash with the doctor's orders.
Whoa. Yeah, that could be tricky.
Right. And then there's handling medical errors
Oh, gosh. Yeah.
and even reporting a colleague who's, well, acting shady, ethically speaking.
Okay, so yeah, no pressure there.
Right.
It's a lot of responsibility. It makes total sense why ethics is such a big deal for nurses. And speaking of responsibility, the PowerPoint mentions something called good professional character. What's that all about?
Okay, so in Texas, there's this rule from the Board of Nursing, Rule Section 213.27 to be exact.
Catchy.
It boils down to this. To be a nurse in Texas, you need a track record of honesty, accountability, trustworthiness,
Makes sense.
reliability, and integrity.
The whole package.
It's not enough to just know the medical stuff. You got to be the kind of person people can,
Yeah.
trust with their lives.
Makes total sense. But it also seems kind of broad. How do they actually, measure good character?
Well, they have specifics. One is recognizing those personal boundaries with patients and respecting them, obviously.
Oh, yeah, that's huge.
Right. And another is being totally transparent if there's any information that could, impact a patient's safety.
So no hiding stuff.
Nope. It's also about keeping promises, owning your mistakes, and always putting the patient first, even when it's tough.
Like always putting their best interests first, no matter what.
Exactly. And that's where the American Nurses Association, the ANA, comes in.
Oh, right. I've heard of
They
them.
have this guiding document, the Code of Ethics.
Uh-huh.
It's been around forever, but it's constantly being updated, keeping up with the times, all the new challenges nurses face.
Okay, so spill the tea. What's in this one?
Well, it's got 9 main provisions, but instead of just listing them all, let's hit on a few that really stand out.
Sounds good.
One is this idea that the nurse's main commitment, like their primary focus, is the patient.
Okay, that's powerful. Not the hospital, not the doctor, but the patient.
Right. Another big one is advocating for patient rights, their health and safety.
So, speaking up, even when it's hard, if you see something risky.
Bingo. It's not just following orders. It's about being a voice for those who might not have one.
I love that. And this is interesting. The code also talks about the nurse's duty to themselves. What does that even mean?
It's things like promoting their own health,
Yeah.
keeping their integrity intact, and even like seeking professional growth.
So it's like take care of yourself so you can take care of others.
Exactly, especially in a profession that can be so demanding, right?
Right. But let's be real. You can have all the codes and rules in the world, but how does a nurse actually apply these principles when faced with a real ethical dilemma?
That's where things get tricky.
Oh, I bet.
And that's why there's a whole process for ethical decision making, like a roadmap, to navigate those tough choices.
I'm ready to map out this ethical road trip. What's the first stop?
First stop, gather all the facts. What's the patient's deal? What do they want? What are the medical options? It's like detective work.
So no jumping to conclusions.
Nope. Then you got to identify the ethical issues, like what values are clashing here, what principles are being challenged.
Okay, got it.
Once that's clear, you brainstorm solutions.
So it's like a creative process, too.
Absolutely. Explore all the options, and then this is important. You hold each one up against those ethical principles we talked about.
Oh, right. Like those become the measuring stick?
Exactly. Does it respect the patient's autonomy? Does it help them? Does it minimize harm?
It's like a filter helping you pick the best path forward.
You got it. Then you take action, but it doesn't end there. The last step is reflecting
Reflecting on what?
on the outcome. Did your choice do what you hoped? Were there surprises? Ethical decision-making is a constant learning curve.
So you're like a lifelong student of ethics.
Pretty much.
Yeah.
But I gotta ask, are there, like, different styles of ethical decision-making, or is it one size fits all?
Right, like are there different schools of thought or something?
You're right. It's not that simple. The PowerPoint mentions a few different approaches, like deontology.
So now on what now?
Deontology.
Yeah.
It's all about doing what's inherently right, no matter the consequences.
So black and white thinking, no matter what.
Kinda, yeah. Then there's teleology, which is all about the outcome.
Okay, so if the action leads to a good result, it's all good. Even if the way you got there was questionable.
It can be tricky. It's about weighing those potential benefits against any harms.
Hmm.
And then there's the situational approach, recognizing that every case is unique.
It's got to be flexible.
Exactly. And no matter which one clicks with you, the point is to have a structured way of thinking through these dilemmas.
So like a framework.
Right.
Mm-hmm.
Speaking of which, the PowerPoint mentions a practical model. It's called the moral model.
Ooh, the moral model. Sounds kind of deep. How does that work?
Well, the M stands for massage the dilemma.
Massage, like a spa treatment for ethical problems.
Not quite. It means really digging into the situation, who's involved, their perspectives, the key issues.
Okay, I'm picturing a detective with a magnifying glass.
Right. Then, outline options.
Like a pros and cons list.
Exactly. Then R for resolve, applying those ethical principles we talked about to each option.
Using them as a guide to pick the best choice.
Exactly. Once you've chosen, you act. You put it into practice. But it doesn't end there. The L stands for look back and evaluate.
Ah, so you learn from each experience.
Exactly. You assess the outcome, learn, and refine your approach for next time.
Always growing, always learning. I love that. Now, are there like examples of this in action?
You bet. The PowerPoint has 4 case studies, real-life examples of nurses dealing with ethical struggles.
Oh, wow, that's cool. Like putting yourself in their shoes.
Exactly. They're great for sparking discussion and, thinking about your own values.
Okay, so speaking of real life application, let's talk about FOSC of practice. I'm kind of fuzzy on that. What's it all about?
Scope of practice. It's all about knowing the boundaries of what a nurse can and can't do.
Okay, I gotta ask, why do we even need a scope of practice? Aren't all healthcare pros like essentially the same?
That's a question I hear a lot. But having these clear boundaries is super important for everyone's safety, especially the patients.
Right, that makes sense.
Make sure everyone's working within their expertise, kind of like lanes on a highway.
Yeah.
Imagine if anyone could just do any medical procedure.
Oh gosh, chaos.
Total chaos. So yeah, those boundaries are there for a reason.
Okay, yeah, that makes sense. But who gets to decide what falls inside those boundaries for nurses?
In Texas, that's the Texas Board of Nursing. The Beyond, they're the rule makers.
Oh, right, the Beyond.
They determine what different types of nurses, LVNs, RNs, APRNs, can do based on their education, training, the whole 9 yards.
So it's not one size fits all.
Nope. This is key. The standard of care for nurses, it's determined by a bunch of things. State laws, research, professional guidelines, even stuff like equipment manuals.
Whoa, that's a lot.
It is. It's like this giant web of information that defines safe and competent nursing practice.
Okay, yeah, that actually makes me feel a lot safer, knowing that there's so much thought put into it.
Right. And to make things even clearer, the Beyond has these positions and guidelines, basically interpretations of the rules.
Oh, so it's like FAQs for nurses.
Exactly. Helping them understand how the rules apply in real life.
Super practical.
Now, there are some standards that apply to all licensed nurses in Texas, regardless of their specific role.
Oh, okay, so universal standards.
Yep. And these really highlight what it means to be a nurse, ethically and legally.
I'm all ears. What are these universal standards that every single nurse in Texas has to follow?
One of the big ones is that nurses cannot do tasks that require independent medical judgment.
Oh, interesting.
That's the doctor's domain. Nurses got to stick to nursing practice, even if they think they know the best medical call.
So knowing when to step back is part of their ethical duty.
Exactly. And nurses are also expected to create a safe environment for their patients. Identify risks, follow infection control protocols.
Like it's their religion.
Right. And if they see something that could put a patient in danger, they got to speak up.
No matter what their specific role is, patient safety comes first.
Always. And understanding medication effects and treatments, that's a big one.
Oh, yeah, that makes sense.
This isn't just about knowing the names of pills. It's about really getting how they work, their side effects, and being able to watch for bad reactions.
Like making sure the cure isn't worse than the disease.
Exactly. And documentation is another big one, keeping those records accurate and up to date.
Yeah, that's got to be super important in such a fast-paced environment.
It is. It ensures continuity of care and protects everyone involved.
Okay, what else? What other universal standards are there?
Respecting patient rights and confidentiality, that's a huge one. Treating patients with dignity, protecting their privacy, all that.
So building trust and making them feel safe.
Exactly. And speaking of feeling safe, nurses are also expected to educate their patients and families. Empower them with information about their condition, treatments, self-care.
It's about giving them the tools to take control of their own health.
You got it. Now, professional boundaries are another big one, maintaining those appropriate relationships with patients.
Right, keeping it professional, even when you might develop a rapport with someone.
Exactly. It protects both the patient and the nurse. And another crucial one is knowing when to ask for help, for supervision or training.
Oh, yeah, recognizing when you're in over your head.
Exactly.
Yeah.
If a nurse sees a new piece of equipment or a situation they haven't dealt with before, they need to be humble enough to ask for help. It's about putting the patient's safety above their ego.
It's like that saying, you don't know what you don't know.
Right. And speaking of real-world challenges, let's talk about the 8-step decision-making model the PM and AD provides.
Oh, yeah, for figuring out their scope of practice.
Exactly. Think of it like a cheat sheet for nurses, helping them figure out if a particular task is within their authorized scope.
Okay, I'm intrigued. Let's break it down. What's the first question a nurse needs to ask themselves?
The first step is all about those legal boundaries. They need to ask, is this thing I'm about to do prohibited by any law, rule, or regulation? If the answer is yes, then that's it. Game over.
So it's like a hard stop.
Yep. If the answer is no, they move on to step 2.
Okay, what's step 2?
Step 2 is making sure they have the proper authorization. They need to ask, is this activity authorized by a valid order? Usually that means a doctor's order, but it could be from another provider, like a nurse practitioner.
So making sure they're not going rogue, even if they have good intentions.
Exactly. No valid order. Outside their scope, got to stop right there.
And if they do have a valid order, what's next?
Well, if they've cleared those first 2 hurdles, they need to look at their workplace. They got to ask, is this thing consistent with the policies and procedures of my hospital or clinic?
So even if it's legally and medically okay, it still has to align with their workplace rules.
Exactly. Different places might have different protocols, so it's important to follow their employer's specific guidelines.
Okay, yeah, that makes sense. Like layers of checks and balances.
You got it. And if they've made it this far, step 4 is all about evidence-based practice.
Evidence-based practice, what's that?
Basically, they need to ask, is this backed up by the latest research and best practices in nursing? Got to make sure they're not using outdated info or techniques.
So staying current with the latest and greatest.
Exactly. This applies to medical knowledge and things like new equipment or procedures. They need proper training and skills before doing certain tasks.
Always learning, always evolving. Pretty cool.
It is. But hold on, we've only made it to step 4. There's 4 more to go.
Okay, I'm hooked. What's next on this ethical checklist?
All right, so step 5. This one's all about being honest with yourself, really looking in the mirror.
Ooh.
The nurse needs to ask, is there, documented proof that I can actually do this safely and effectively? Really, truly, no sugarcoating.
So it's not just what they're allowed to do, but if they're actually capable.
Exactly. If the answer is no, or even maybe not, got to seek more training or supervision. Patient safety always comes first, got to swallow your pride sometimes.
That takes humility.
Big time. But that humility, it's essential for ethical nursing.
Yeah.
Okay, so assuming they feel good about their skills, we move on to step 6. This one's interesting. They got to ask themselves, would a reasonable and prudent nurse do this in this situation?
So they're like checking in with their professional gut instinct.
Right. It's about using that collective wisdom of the nursing world, what would a typical nurse with similar training do? If their gut says, most nurses wouldn't touch this, that's a red flag.
It's like having a whole team of experienced nurses in their head, giving advice.
I like that.
Yeah.
Okay, step 7, this one's about taking ownership. The question is, am I ready to accept full responsibility for what happens?
Whoa, yeah, that's a heavy one.
It is. If they have any doubt about handling the consequences, good or bad, they got to step back.
It's having the courage to say, nope, not my scope, even when there's pressure to do more.
Exactly. And finally, step 8. This one's just for LVNs, licensed vocational nurses.
Oh, right. They're under the supervision of others, right?
Yep. So for them, it's all about making sure they have the support they need.
Okay, so what's the final question on their checklist?
It's simple. Will I have enough supervision, if I do this.
Makes sense, especially since their scope is a bit more limited.
Right. If an LVN doesn't have that RN or physician available, even a simple task could be off limits.
This whole model is so helpful. It breaks down something complex into these clear, doable steps.
I hope so. It's a great tool for navigating those gray areas. Now, before we jump ahead, I want to touch on accreditation standards. You might be wondering, what do those have to do with all this?
I was actually wondering that. It seems like a whole other topic.
It's all connected. Accreditation standards are set by groups like the Joint Commission. They basically set the bar for quality and safety in hospitals and other healthcare places.
So they're like the quality control folks.
Yep. And these standards cover everything: patient confidentiality, medication safety, how care plans are made, you name it.
Sounds super thorough.
It is. And here's why it matters for our discussion. If a nurse is working in a place that's not meeting these standards, it can create, like, ethical dilemmas for them.
Oh, I see. Like, what if they're asked to cut corners or safety isn't a priority?
Exactly. Puts them in a tough spot, ethically and professionally. So understanding these standards and fighting for them is a big part of a nurse's ethical duty.
It's about that culture of safety and doing things the right way.
Now, to see how all this fits together, the ethics, the scope, the standards, let's talk about how scope of practice changes depending on the type of nurse.
Okay, so different levels of nursing, like fresh out of school versus super experienced.
Right. Let's start with graduate nurses, GNs. They finished school but haven't passed their licensing exam yet.
So they're kind of in limbo. They have the knowledge, but can't legally practice on their own.
Yep, think of them like interns, eager to learn, but still under supervision. They need a lot of guidance from experienced RNs.
And I'm guessing their scope of practice is pretty limited at
It-
this stage.
Definitely. No supervisory roles, no charge nurse positions. They also can't practice independently, like in home health, where they wouldn't have that immediate backup.
So it's a safe space for them to learn and grow.
Exactly. Now, once a nurse passes that exam, they become a new RN, a new registered nurse. Big moment. But they're still considered new to the game, need some hand-holding.
So they've earned their wings, but still need a co-pilot.
Love that. Usually new RNs are supervised for their first 6 months. No charge nurse duties, no supervising others. And like GNs, they shouldn't be doing independent practice for a while, at least a year, maybe 18 months.
Building that solid foundation, getting that support system in place.
Makes sense, right? Now, what about experienced RNs? They're the ones calling the shots, right?
Yeah, they've put in the time, they've got the experience.
Exactly. Experienced RNs, they've honed their skills, proven themselves. Their scope of practice is much wider, and they can handle more complex stuff independently.
Okay, so what exactly can they do? What's their scope like?
One of the big things is figuring out the patient's needs, but not just treating symptoms. They take a holistic approach.
So looking at the whole picture, not just the immediate problem.
Right. Medical history, current condition, emotional state, even social and environmental stuff. They're caring for the person, not just the disease.
It's like detective work, but for healthcare.
I love that. And they use those skills to do these comprehensive assessments, gather all sorts of data about the patient, physical, emotional, cognitive, the whole 9 yards.
Building a complete picture of the patient's health.
Right. And based on all that, they create individualized care plans.
So like a roadmap for getting better.
Exactly. The experienced RN is the guide, keeping the patient on track, adjusting the route if needed. They put those plans into action: medications, wound care, education, whatever's needed.
So they're hands-on with the patients, providing that direct care.
Yes. But they also lead, delegate tasks to LVNs, CNAs, making sure everyone's doing the right things safely.
Like the conductor of an orchestra, making sure it all flows together.
Exactly. And throughout all this, they're constantly checking the patient's progress, making tweaks to the plan as needed. It's a dynamic process, needs critical thinking, good judgment, and a whole lot of compassion.
Sounds demanding, but also really fulfilling.
It is. Now, what about licensed vocational nurses, LVNs? Where do they fit in?
Right, LVNs, they provide direct care but under supervision, right?
Yep. Their scope is more limited than RNs, but they're super important for making sure patients get the care they need.
So who are they answering to in terms of supervision?
It depends on the setting, but it could be an RN, an advanced practice nurse, a PA, a doctor, even a dentist.
Wow, a lot of options.
Right. They focus on those predictable healthcare needs, things that are routine, standardized, where the patient's condition is pretty stable.
So it's about providing that consistent care for patients who don't need the RN's level of expertise?
Exactly. They're following the care plan set by the RN or other provider, doing what's within their scope.
So, like, What are some things LVNs typically do?
A lot of basic nursing care, vital signs, medications, helping patients with daily activities, watching for changes in their condition.
The essentials?
Yep, wound care, tube feedings, all sorts of things, but always under the RN's direction.
So they free up the RNs to handle the more complex stuff.
Right. They keep things running smoothly. Now, there's one unique thing LVNs can do. They can be a nurse first assistant, an NFA, during surgery.
Whoa, really? In the operating room?
Yep, they help the surgeon with prepping, instruments, suction, all that. It's a specialized role. Got to be under direct supervision, like right there in the sterile field.
So not just the skills, but the right supervision for that critical environment.
Absolutely. And the PowerPoint makes it clear an APRN or a PA can't supervise an LVN doing this. Has to be the surgeon themselves.
Makes sense. What else do LVNs do?
They also keep an eye on how patients are responding to care, report any changes to the RN. They're like the eyes and ears on the ground.
Always watching, always paying attention.
Exactly. And LVNs can supervise CNAs, certified nursing assistants, delegate tasks, make sure things are done right.
So a little bit of leadership too, but always within that framework of being supervised.
Exactly. Now let's talk about the superstars, the Advanced Practice Registered Nurses, APRNs.
Ooh, yeah, the APRNs, they've got that extra training, right?
They do. Master's degree, sometimes a doctorate. They handle more complex cases, make more independent decisions, and in many states they can even prescribe meds.
That's a big deal, being able to prescribe.
It is. It gives them more autonomy, but there's still rules,
Yeah.
especially for controlled substances.
Right, it's about balancing that independence with responsibility, making sure patients are safe.
Exactly. What kinds of APRNs are there? You name it, they probably exist. Family practice, pediatrics, geriatrics, women's health, mental health, everything.
Wow, they really do cover the whole spectrum.
They do. They're vital for meeting the complex healthcare needs we have today.
Now, before we wrap up, I want to circle back to those accreditation standards. Why are those so important, and what happens if they're not met?
Accreditation standards, they're all about making sure healthcare facilities are hitting those benchmarks for safety, quality, patient satisfaction.
It's like a stamp of approval. This place is good.
Exactly. And for the facilities, it's not just bragging rights. It affects their reputation, how many patients they get, even their insurance reimbursements.
So, high stakes.
Yeah. But what if they don't measure up? What happens then? Well, the big one is they could lose their accreditation.
Ouch, that's gonna hurt.
It does. Hurts the reputation, makes it harder to operate. And for individual nurses, not meeting those standards can mean serious trouble. Disciplinary action from the Board of Nursing, reprimands, fines, suspension, even losing their license.
So yeah, the stakes are high for everyone.
They are. It all goes back to keeping patients safe and upholding the nursing profession.
This deep dive has been amazing. We've learned so much, from those basic ethical principles to how scope of practice changes for different nurses, to those all-important accreditation standards.
It's been a journey, exploring this world where ethics, law, and real-life nursing all come together.
And I gotta say, I have so much respect for nurses now. They're not just following orders, they're making tough choices, speaking up for their patients, dealing with these ethical challenges all the time. They're the real heroes.
Couldn't agree more.
Now, as we wrap up, I want to leave our listeners with something to think about. Given everything we've talked about, the ethics, the scope of practice, the challenges, what do you think is the biggest hurdle nurses face in providing safe and ethical care today?
That's a great question, and there's no easy answer. It's something for all of us to think about as we consider the future of healthcare and the role nurses play.
Well, I'm definitely walking away with a deeper understanding of the nursing world and a whole lot of respect for the amazing work they do.
It's a constantly changing field, for sure.
Yeah,
But, it's funny, we talk a lot about the skills and knowledge nurses need, the clinical stuff.
right, the textbook stuff.
Yeah, but we don't always talk about that emotional intelligence,
Yeah.
that ability to make good, ethical decisions, which is just as important for great care.
It's like they need to be both scientists and humanists, right?
Right.
Clinical experts, but also understanding people and ethics.
Exactly.
Right.
And that's especially true with those accreditation standards we talked about, remember? They're not just about checking boxes. They're about building a culture of safety and responsibility where nurses can, thrive.
Right, where they can do their best work.
And where patients feel confident they're getting the best care. And what's interesting to me is how those standards touch on so many parts of nursing. It's not just about medical procedures or technical stuff.
Right, it's bigger than that.
It's about communication, working together, advocating for patients, creating an environment where everyone feels respected like they matter.
That makes a huge difference, I bet.
It does.
Uh,
And I think that's what makes nursing so special, so rewarding. It's not just about tasks and rules. It's about human connection, compassion,
mm.
actually making a difference.
It's about being there for people when they're at their most vulnerable, being that steady presence, that voice for them when they need it. And sometimes it's about having the guts to speak up when something's wrong, even if it's scary.
You nailed it. Ethical nursing, it's not always easy, but it's always important. That's what we want people to take away from this.
Absolutely. So, to all the amazing nurses out there, thank you. Thank you for your dedication, your compassion, your commitment to doing what's right.
Yeah.
You truly are the heart of healthcare.
Couldn't have said it better myself.
And to our listeners, we hope this deep dive has given you a peek into the world of nursing ethics and scope of practice. It's something worth thinking about, and we encourage you to keep learning, keep exploring.
There's always more to discover.
Until next time, keep diving deep.